Okay, I have a couple of exercise related questions. And I know this is like close to your heart and you've got a lot of good advice here. So, the first one, do we have any research that shows if regular physical activity affects the progression of metastatic breast cancer? But maybe you can also just talk, like, kind of in general about risk reduction and exercise studies.
So exercise is the one thing that actually really lowers our risk. All these other things, drinking alcohol and maybe the diet, they can increase your risk, but exercise lowers your risk, and it lowers your risk of recurrence, lowers your risk of disease progression. Plus, it helps you feel better as you move. Now, the challenge is if you don't feel great, if you're faced with neuropathy and fatigue and joint pain, and here I am saying, well, 150 minutes a week, you're not doing that, right? Like, again, talk about stress. And so I think starting small, and that can mean a 5-minute walk to your mailbox and back. Maybe that you walk down the block and back. It doesn't have to be the 150 minutes, right? More is better. But if you're not doing that, you got to build and work your way up to that. And for some people, I love things like chair yoga, something very gentle. There's a lot of great resources out there about starting slow. It may be even picking up 1 pound weights or walking with ankle weights, swimming in a pool. Physical therapy, especially in the metastatic disease, physical therapy when you're on treatment and long term and have all these side effects. PT can be great at starting to do the stretching and everything. So start slow, but any movement is better than no movement.
Okay. Um, so then a specific kind of side effect from treatment, and I think that you might say that exercise can help with this, but if there's any way to avoid or maybe push off for as long as possible osteopenia or osteoporosis when having to be on endocrine therapy, possibly for life.
I mean, 100% exercise, but specifically here, we're talking about weight bearing activity. Um, so you want something that, walking is great. And this is where I love walking with the ankle weights because or some people will do the weighted vests. You just put them on. So that doesn't require, you're not talking about Olympic weightlifting here, but you're walking with some extra weight on you. And that really can be helpful. So I love even weight bearing activity things like so walking, maybe body weight exercises, squats and lunges. Lifting weights can be helpful as well. But exercise number one, of course, making sure the calcium and vitamin D level are good. Um, but really, the more weight bearing activity that someone can do, the better.
Okay. Yeah, and that's nice just to clarify, it doesn't mean getting into the gym necessarily and lifting like heavy weights. It's just even a walk, if you do something as simple as putting on ankle weights
And
or
I will say too is that just because you're on endocrine therapy for life or for 10 years or whatever, 5 years, whatever it is, you're not doomed to definitively have osteoporosis. So I think there's been a little bit of a narrative, especially in social media recently, where people are saying if you don't have HRT, you're gonna have osteoporosis, and now you're on these meds and you can't have HRT. And that's not necessarily true. I can tell you, I see people every single day in my clinic who are on these aromatase inhibitors, who've been on them for years, and they have managed to reverse their bone density, not even just stabilize it, but reverse it from osteoporosis with exercise. So and of course, there are also medications. We didn't talk about that, but there are bone modifying medications that we can use in certain cases as well, like Prolia or Reclass or Zometa.
okay. Yes. Could you, just because we have a couple, we've